Hello, so I'm going to show you some mobility exercises. This is going to be in the second and the third trimester sections, because depending on whether you're carrying one or more baby, and depending on kind of where you're carrying your baby, you might be feeling more discomfort earlier on than the third trimester, so I thought I'd put it in early. I'm 27 weeks now, and I've noticed that just every time I wake up there is some kind of ache or pain going on, so I thought I would include a selection of stretches to see what helps. Now by all means you can skip forward 10 seconds every now and again just to go to the next exercise, but I thought you can always go through them and see what feels good, where feels niggly in your body, get to know the stretches, and then you can do them in your own time at your own pace. So I'm going to take my time. The equipment that I've got a resistance band. You can use any resistance band, and I've also got a broomstick, so just detach the broom from the head or the mop from the head, you can use that stick. If you've got a wall handy as well, maybe grab or place yourself near a wall just in case. So the first one, I'm finding that when I'm asleep, especially now I'm sleeping on my side, that I'm pulling, I'll do the other side, sleeping on my left, so I'm pulling my shoulder forward, and that is putting all of my shoulder blade on a good old stretch, and then it's not happy in the morning because I've shortened this side. So the first stretch we're going to do is just a revolution. It's just kind of opening the chest, and I'll show you with the band. So you don't want to fight it, so that's probably a bit tight. It's just for some support. You're just going to go back and forth, opening up the chest, not stretching the back. That's been stretched enough. I'm just going to go back and forth, see if I can get some mobility through the shoulder. So keep going with that. I'm just going to show you what it looks like with a stick. If you want a little bit more resistance, and have a long stick so you can have your arms wide. But if you notice that that is a bit too tight and maybe you're struggling, go back to the band. That is a bit too tight for me today. Oopsie. So going back and forth, and then you can widen the feet and just go diagonal. So roll the body down and up, roll the body down forward and up, and roll the body down, diagonal. The other way, just see which side feels like you need to stretch and go with whichever side works for you best. The other one, we could start going round in a circle. And again, we're going to get the body involved a little bit, so pivoting round, a little bit bigger. Take your time. Feel what feels good. Get the legs involved if you wish, and then we'll go the other way. That's it. And we'll get a bit smaller. So if you want to spend longer on it, by all means, that's enough for my shoulders today. So just take a big breath in and out. Relax. Most important thing when it comes to relaxing the body, when it comes to stretches, is our breathing, because if we're tight, I know when I pulled my left shoulder forward and it pulled, I went, ooh, and you kind of grit your teeth a little bit. So breathing through, relax the jaw, lips together, teeth apart, rest the tip of the tongue on the roof of your mouth. It'll just help to remind the brain that you're safe, it's okay, and we're gonna get through this. it's not going to be too much of a drama. Same, so when we go into labour, that kind of breathing will really help to calm the nervous system when it is in a heightened, high stress situation, such as the pain of childbirth. So the next one, kind of same but different. I'm going to open the chest, I'm going to stretch our legs as well. So just turning to one side, I've got my left foot forward, right foot back. I always like to do left forward first. Reminds me that I've done both sides. And what we're going to do, so you are going to be reaching up, and again it's going to open the chest up. You're going to push forward with the hips, but you're not going to lean back too far. You don't want to put too much strain on the front of your tummy. So easy to get out of breath at the moment as well, apologies for the panting. So reaching up, and then take your time. If you want to practice this movement, grab that stick again for balance. So push forward and then drive the hips back, and you're kind of rolling down, keeping that front leg straight but bending the back leg, and then standing up, push the hips forward, push the hips back, and then when you've got the hang of it, I'll use the stick for an example, push the hips forward, reaching up, stretching through the upper body, and then rolling down and rounding. You don't have to be a perfectly straight back. And then if you wish, you can go up and then roll down to the inside of the front leg, going up, roll down to the outside of the front leg. And again, if balance is an issue, have that stick handy, push, roll down, push, roll down. So make sure you've got stable base, you're not on a slippery floor. And you can change this again next time you go through it. I'll demonstrate on the other side. So now I've got my right foot forward, left foot back. You can have your foot turned in or out. So that is going to make a difference as well. So you can try that. And again, you're going back and forward. Good. Take your time. So we're stretching out the front of the back leg and then the back of the front leg. Straighten the leg as much as you can. You don't have to go all the way down to the floor, you can just go that far, just bending over a little bit. Kind of getting some mobility through the body. And then pivot. There's the inside. So you can do a few reps there. Looking good. Again, pause if you wish. I'm going to go to the outside of my foot now. So leaning over this way, this is getting into that shoulder blade as well, where it was feeling sore. And you're bending over as far as you can, as far as your tummy will let you, as far as your flexibility or your balance will let you. Okay. And then let's just reach up and then roll down as low as you can go. Take a big breath in and then rolling up. So you started off with your arms straight up, now bring your arms out like a letter Y. Inhale, exhale, roll down. Let yourself hang for just a second or two. Inhale, exhale, rolling up. Arms out to the side. Make yourself tall, but make your chest open. Rolling down. Rolling up, bring your arms overhead. Nice and slow. You don't want to think about getting yourself dizzy. That really reach up, pull up. I don't know about you, but I'm like when I used to lie on the floor on my back, just doing that movement would help release some things and help everything click a little bit. As soon as we can't lie down, why arms? As soon as we can't lie down, it's good to find something kind of does the same thing. Okay, let's roll down one more time. Hang there for a second and just sway from side to side, drawing a semicircle from the outside of your right leg, the outside of your left leg. And then if you wish, you can have your toes pointing in, or you can have your toes pointing out. Have a play every time you do this, stretch to whatever feels good for your body. Okay, big breath in. And exhale, rolling up. Okay, let's grab our pole again. And what we're going to do is kind of bend over and reach arm overhead towards the pole. The pole's kind of there for balance. You don't need it if your balance is good. If you're feeling a bit tired, a bit tender, a bit sore anyway, why put yourself under any more stress? So reaching over so that you can lean the stick away. Have a play. Good. Reach. So we're opening up all the side of our body. One more. And then let's go to the other side. Have your legs together, legs apart, whatever works for you. Reach over. Good. So how this will look without the stick, I like to have this arm go the other way. Or you can have it going down your leg. Or hold on to a table, chair, or wall. Okay, so nice big breath in. Relaxing through the body. And all of these are going to help with your posture. As we get bigger, like as our chest gets bigger, we might want to round forwards. As our tummy gets bigger, we might want to start leaning back to compensate. All of these things can result in long-term niggles and pain throughout our pregnancy, and we don't want that. So just check in every now and again, just make sure that you are standing up as tall as you can. Proud chest, hips push forward a little bit, not squeezing, but push forward. And that brings me on to the next exercise. This is a lateral wave, or stop and wave if you've done one of my other courses. Place your hand out. This is where a wall is really handy. You can place your hand on the wall. And you're going to sway the hips side to side. This is where it's nice to be upright, keep the shoulder relaxed. And you're going to swing over and under. So it's a bit like the other one. I'll place my hand here to show you. You can really get into it. So you're going to go under, over. And it gets into into the groin, into the hips, so everything's going to open up nicely. If you're feeling a bit tight, a bit sore, and you're trying to limber yourself up, prepare yourself for labour, or just ease any painful hips. Take your time though, so if you're noticing any pain in and around the hip joints, anywhere during these, reduce the movement or move on to something else. There's no point in pushing through the pain. If you feel like you can, just do a little bit and have a feel. And just check in with your hips. Then do what works for you. Okay? Let's put the other hand out. Swing the hips side to side. No going over. And under. Now, none of these stretches are going to be miracle workers the first time round, but they might help just to get the blood flowing, get any niggles feeling a little bit better, a little bit less painful. The more you do them, the better it will be. So make a note of the exercises that work for you, and just repeat them as and when. I'm going to go onto the floor, I think, next. I'm just going to move, I'll use my stick to get down. This one you can do standing, but we might as well take some pressure off our back for a moment. So, turn around there. We'll go into cat-cow first. Now, with the cow part, only go as far as you can. So we're going to do cat, tucking the hips under, arching the back. If you want, you can really push the spine, and then push the hips up. You're going to feel a stretch along here, so only go as far as is comfortable. And then back. Think about each vertebrae is just moving gently back and forth. And then find a neutral position for you. And swish your hips left to right. And then when you're ready, you look over your shoulder towards the hip as it moves. Both go to the left, and then look to the right as your hip goes to the right. Just kind of opening up the hips a little bit. Okay, and then I'll turn to the side, I'll turn to face you so you can see. I'm going to take my right hand, I'm going to thread it through the hole created by my left arm and left leg. I'm going to reach as far as I can, as if I'm trying to touch the couch over there. Then I'm going to pull it back. Keep looking at the fingers on your right hand. Go out to the right side. Rotate the body as far as you can. Point your hands up towards the ceiling. Or as far as you can while still being able to see your hand. Come back down. Reach across. That's it. So nice gentle rotation. Nothing too crazy. And then if you can, might need to take your legs a little bit wider, thread your arm through that hole, drop down as low as you can get to the floor. If your shoulder can touch the floor, great. Use your left hand to support yourself and just position yourself so you feel that you're getting a nice stretch through your upper back on that right side. Big breath in, just let the tummy relax at this point. In and out, just nice and relaxed. Breathe into whatever feels tight. Imagine it softening and relaxing as you breathe out. In through the nose, out through the nose, lips together, teeth apart. Tip of the tongue on the roof of your mouth. Good. Oh, I could have stayed there all day. Let's do the same on the other side. So thread the left arm through the hole created by your right arm and leg, and then bring it back under the body, out to the left side, round and up to the ceiling as far as you can go. And then back. So in your own time, at your own pace. If you feel any tugging or pulling, just go a little bit less. And thread through. Drop the shoulder down to the floor if you can, using your right hand for support. Big breaths in and out through the nose. Coming back up onto all fours, bring your legs wider still if you can, feet together, knees apart, reaching the arms forward, head to the floor for child's pose. Now let's move both arms over to the left, so point to your left arm, just diagonally to the left, like to 10 o'clock, put your right hand on top of your left. And then move both arms out to the right, about 2 o'clock. And both arms to the centre. Walk yourself back up. And that brings us to the end of that stretch session. So let me know in the group how that felt, how you got on, whether you're feeling any more limber or whether I just missed the mark completely of the stretches. This was more directed towards upper back mobility. So if you want a specific stretch routine for maybe lower back or hips or legs, then please do let me know. Hope you enjoyed that. I will see you in the next video. Bye for now.